Okay, thank you everyone. It looks as though we are live on YouTube and we'll get started in just 2 minutes. Again, if you are not a member of the media, I would encourage you to hop off and follow us along on YouTube. And we will get started in just 2 minutes here. A couple folks who seem to have their microphone unmuted, please mute your microphone if you're not one of our speakers. If not, we'll have to kick you out of the Zoom. Okay, I have 1 o'clock over here. I'm letting in the last couple of folks from the waiting room. But Governor, if you are ready, we are live on YouTube and we are ready for you when you are.
Ready to go. Okay, good afternoon. Thank you everyone for being here with us today. I appreciate it. I want to take some time today to talk to Nevadans about where we are in our COVID-19 surge and to make an encouraging announcement about at-home COVID-19 testing. As you know, the Office of Analytics has been tracking and reporting on cases, deaths, hospitalizations, and immunizations daily. Cases have continued to increase since mid-December, and daily new cases have exceeded the winter surge of 2020. This is the fastest case growth we have seen since the beginning of the pandemic. Case counts continue to rise due to the increased transmissibility of the Omicron variant, and our hospitals are reporting increases in both Clark and Washoe counties. Right now, hospitalizations are stable in rural counties. With case increases in rural counties, we are expecting to see increased hospitalizations in rural counties soon. Fortunately, as of now, the Office of Analytics has not reported a significant increase in deaths due to this surge, and I am hopeful that data does not materialize. I want to remind Nevadans that this moment in time is very different from where we found ourselves in March of 2020. We have incredibly powerful tools to help fight the virus, the most powerful of which are the COVID-19 vaccines and therapeutics. Though Omicron has made some therapeutics less effective, there are new therapeutics being introduced regularly. That is why I have put over $19 million into standing up free therapeutic services throughout Nevada. We're working daily to ensure that Nevada is well positioned to live with COVID. That is why Nevada more than doubled our stockpile of PPE. We do not want to risk our ability to respond due to supply chain issues or lack of resources. I continue to urge all Nevadans to get vaccinated as soon as possible and to get your COVID-19 booster as soon as you're eligible. Vaccines are widely available and they help prevent severe cases of COVID-19, hospitalizations, and deaths. Though we expect to see breakthrough cases, the severity of disease among those vaccinated is substantially less. Through this case surge, we have a matching surge in demand for COVID-19 testing. I've been working with the state team to ensure that we're doing all that we can to meet this current demand for testing, and more importantly, build a more sustainable testing model for the future. This will ensure that as we live with COVID, the supply chain does not dictate access for Nevadans. And last week, we finalized an order of more than 500,000 take-home rapid COVID tests. This order is being covered by federal COVID relief funding. This is the test that I'm speaking of. I've asked the shipment and delivery of these tests to be as fast-tracked as possible to meet the current need. We expect the first shipment of the FlowFlex COVID-19 antigen home test to arrive in Nevada at the end of this month. Our team is eagerly tracking these shipments and providing updates to our community partners who will help us get them into the hands of Nevadans. These kits will arrive at locations across the state, with the bulk heading to Southern Nevada, including the health and fire districts, libraries, healthcare clinics, chambers of commerce, community organizations, and more. And they will be distributed statewide, Northern Nevada, Southern Nevada, and our rural communities. We put out a call to community partners to serve as distribution sites for these kits last Friday. In less than 1 week, we have had almost 90 partners step up to help service sites who will be directly shipped these kits at the end of the month. I want to thank all of them for serving our community in this way. We will be updating the COVID-19 testing page on the Nevada Health Response website as more information comes in, so Nevadans will know when these shipments arrive and where they will be located in our communities for pickup. All of our local efforts are complemented by the efforts of our federal partners, who will also be distributing at-home and point-of-care COVID tests throughout our state as part of President Biden's plan. We know that Nevadans want easy and convenient access to COVID-19 testing from the comfort of their own home. And this project will help us accomplish that goal and help relieve some of the strain on our other testing systems. I've asked Julia Peak in the Department of Health and Human Services to join me today to talk about our overall work on COVID-19 testing. But before I turn it over to Julia, I want to mention the new COVID-19 drive-through locations in Clark County. The site at Texas Station opened yesterday, and an additional site at Fiesta Henderson will open on Saturday. These sites are a prime example of the work that can be done when the state, federal government, and local officials work in collaboration. The state, particularly the Division of Emergency Management and Division of Public and Behavioral Health, worked to put in a request with the federal U.S. Department of Health and Human Services to help get these sites up and running. These sites will be run collaboratively between the Southern Nevada Health District and Clark County. The current site, Sam Boyd Stadium, is run collaboratively between Clark County and the Nevada National Guard. Please, if you are sick or have been exposed to someone with COVID-19, seek a COVID test. The state is working hand in hand with federal and local partners to ensure more testing is made available. Please, again, if you have COVID symptoms, you should assume that you have COVID and take steps to isolate yourself or seek medical care if needed. If you have been exposed to someone with COVID, seek a test at the various locations within your community. The state is working hand in hand with federal and local partners to increase our testing options every single day. At this time, I'd like to turn it over to Ms. Julia Peak for some more updates. We'll both be able to take some questions at the end. Thank you.
Great, thank you, Governor. The state of Nevada continues to push forward to create more sustainable COVID-19 testing options. The demand for testing and the type of testing throughout the pandemic has varied, and Nevada is constantly adapting to meet the public demand using every method possible. The convenience of at-home rapid tests will make a big difference for Nevadans, and I'm grateful for the governor's dedication to ensuring we can use federal funds on this resource. The governor has been diligent to empower us in public health to learn from crises and adapt to ensure that we can continue to respond to COVID as it evolves. First, this was true in giving us resources to stand up case investigation and contact tracing to levels that this state has never seen. Then to purchase a stockpile of PPE that is double what we've had in the past. We requested support for funding for therapeutics so Nevadans would not need to worry about the ability to pay to access treatment, vaccination services, and now at-home testing. And everything has been supported. Now we are thankful to have the funding and access to at-home test kits and the partners to get them in the hands of Nevadans. These are antigen tests that are most accurate and effective when an individual is symptomatic, but have been used for asymptomatic screening, especially in situations in which a person has known exposure to a person with COVID. In addition to these take-home rapid kits, we are also finalizing the plans where rapid tests purchased from our federal partners will be sent to Nevadans as well. We are waiting on approval from the federal government and information on when to expect these tests, but this will be a supplemental test to what the governor has ordered. These tests are a vital tool for Nevadans. We remind those with a positive result to self-isolate to limit the spread among their family members, coworkers, and friends. They should also inform their own close contacts of the exposure. As we know, Nevada's public health system was fragile even before the pandemic, and we've worked through the pandemic to shore up weaknesses to help save lives and provide resources. We have been incredibly blessed that our governor and legislature have allowed us to access the resources we need throughout our response. We completely understand the level of COVID fatigue you all have and want to say that our teams are equally fatigued, but we are doing everything in our power to provide the resources you need to keep yourself and your family healthy, your kids in school, hospital beds open, and our economy growing. At this time, I want to turn it over to the Nevada Division of Emergency Management Chief, Dave Fogerson, to talk about how the state works with local and federal resources to handle emergency resources and staffing. I also want to personally thank Dave and his team and our National Guard, who have never failed to impress me and our team at Public Health with their professionalism and support throughout this response.
Thank you, Julia, and thank you, Governor, for your continued dedication to clearing obstacles and connecting resources. Today, I want to remind members of the press and the public how the Division of Emergency Management functions during emergencies so that we can ensure that all needs are met with the best resources available. I've said this before, but all emergencies are locally executed, state guided, and federally supported. Local leaders know their communities best and are the first to identify the needs on the ground. Local partners work with their requests for support up to their county emergency manager. If the county emergency manager is unable to fulfill that request, they will often move that request up to the state, and that's where our team gets involved. We will look at the request and our primary focus on what is the mission they're trying to accomplish and what is the best way to achieve that goal. Often we can fulfill that request through state employees being temporarily reassigned, connecting local leaders with their counterparts in other areas of the state who have capacity, or looking at volunteer groups. When it comes to the Nevada National Guard, I wanted to remind everyone that the men and women of the Guard are members of our community here in Nevada, and many of them serve in the Guard part-time. We have about 4,500 Guard members. They are still actively engaged in our COVID-19 mission, most notably providing testing and vaccination support across the state. This is the largest and lengthiest mission in state history. We also have Guard members who are currently serving overseas. We are deeply grateful for their service, and while we continue to evaluate all requests for National Guard missions, there are times when we will not be able to fulfill those requests, or if the request will be deemed inappropriate for what the Guard is charged with. If the state is unable to fulfill a request and the mission is deemed necessary, federal support can always be requested. FEMA is embedded within our Emergency Operations Center with 3 personnel to assist us with requests, provide situational awareness of how other states are accomplishing the mission, and other like items to make that partnership work. Because it is a partnership between all levels, local, tribal, state, federal, and nonprofits to accomplish what is needed to keep people safe. We will not always be able to fulfill all requests because we may not have the right resources to meet the need, but we'll always work with our local partners on our shared mission. Thank you for your time, and we'll now turn it back over to Megan for questions from members from the press.
Thank you, Governor Julia and Chief Fogerson. I see quite a few hands raised already. So if you're a member of the press, please go ahead and raise your hand and we will get you on the list to take as many questions as we can. We'll start with John Trainer from News 3 and then Jeremy from Channel 8, if I'm getting those outlets correct. John, go ahead.
Yeah, you got mine right. News 3 here. Kind of a 2-part question for the governor, if I could. One, how will those 500,000 tests be distributed? Obviously, that number is going to go pretty quickly, I would guess. And secondly, what's the reaction to the Supreme Court decision today on the vaccine mandate for businesses?
Well, I'll go with the second part first. I'm disappointed with the Supreme Court decision, but we're still encouraging employers to get people vaccinated. Vaccinations are our way out of this and booster shots. So hopefully people will continue to do that. And pleased that the Supreme Court did go ahead with the healthcare option for those folks to get the vaccination. So that was a good thing. The test will be distributed through our partners that we've mentioned previously. We've got over 90 partners already that have volunteered to help us distribute these into the community. They'll be shipped directly to these volunteer agencies so that we can get them in people's hands quicker. And we're working with them and my team to come up with a plan, what the hours are going to be, how many tests people are going to get, that sort of thing when they go get them. But we want to get them in hands of people as soon as we possibly can. So rather than have to accept them and then reship them, we're shipping them directly to the partners.
Thank you, Governor. Thank you, John, for the question. We'll use that landing page on NV Health Response that the governor talked about. That'll have the full list of where tests will be available, and we'll keep that updated in the coming weeks. We'll go Jeremy from 8, and then Jacqueline from 5, if I'm getting those correct.
Actually from Channel 13, but thank you, Megan. This question's for you, Governor Sisolak. Kind of expanding on the Supreme Court ruling, is there any sort of discussion within the state of Nevada, whether it's you or other health officials, about making kind of your own vaccine mandate for businesses within the state?
I deal with my team on this on a regular basis. We don't want to force things through mandates. What I would prefer to do is just encourage people to get the vaccination and get the booster. If you talk to your healthcare providers, you talk to our hospitals, which are being stressed now with capacity issues, the vast, vast majority of people that are being hospitalized are unvaccinated individuals. So if you want to protect yourself and your family and our economy, get the vaccination, but we don't have any more mandates planned right now, Jeremy.
Thank you.
Thanks, Jeremy. Sorry about that, mixing up the outlet. We'll go to Jacqueline from 5 and Ken from AP. I feel confident in those outlets.
Question for Julia P. Could you elaborate a little bit more on where exactly, ideally, the test kits will be available for all Nevadans, just in terms of what type of facilities and the protocol for how they can obtain it? And also a question for emergency management as well. What can be done, since the Nevada Hospital Association has asked for help from the state with staffing? What can be done to assist hospitals in this time?
Perfect. Thank you, Jacqueline. So as the governor mentioned, last Friday, we started reaching out to our partners. That included our traditional public health agencies, but also libraries, childcare centers. Some of our biggest orders will be going to our sites through the Division of Welfare and Supportive Services. So folks will be able to see that entire list. As the governor mentioned, it's over 90 entities. And so we'll be able to provide that mapped out so folks can see the closest location to them. Dave?
Thank you for the question. Absolutely. We've got a lot of requests, not just in the Nevada Hospital Association, but from our local partners, because that's how emergency management works. We won't take the request from Nevada Hospital Association. We take the request from the county emergency manager. And what we're doing is we're working with those locals to find what is the issue, what are the staffing needs that we need, and how we can fix the issue. Some of it is by decompressing the hospitals. And by opening more testing sites, we can keep people out of the emergency departments. That enables those healthcare providers to do their jobs within the hospital a little easier. And that's the purpose of these home test kits and then opening the 2 larger testing sites in the South. There's other things we can do, connecting to different resources. That way they can get traveling nurses or other staff from other agencies. And those are the discussions that we're currently underway with right now with the Clark County Office of Emergency Management on how we do that and how do we incentivize maybe some of those traveling nurses from other areas to come here to Nevada, to our hospitals, because they are a very scarce resource. California ordered 10,000 nurses. Texas has ordered 13,000 nurses. And so it's a way of trying to find ways to maximize what we have and help everyone get through the pandemic.
And before maybe we go to another question, I want to give a shout out to our healthcare frontline providers, our doctors, our nurses, our cafeteria workers, our maintenance people, everybody that's working in a healthcare facility is going above and beyond in this very stressful time. We thank them for what they're doing. They're helping to save lives and to make people as comfortable as possible. And a lot of frontline workers, whether they're educators or grocery store clerks or truck drivers, but our healthcare workers are really being stressed right now. That's why we need to do everything we can to help them along the way here.
Thanks, Governor. You interrupt me anytime you want. We'll go Ken Ritter from the AP and then Jonah from the RJ.
Thanks, Megan. If you can hear me.
I hear you, Ken.
Okay, best of the new year to all of you. Question, how did you settle on 500,000 tests for Nevada? State of Nevada, the state of Montana today said they're ordering 650,000. And that's a state with about 1 million people.
Well, I'd order 650,000 more on top of the 580 we've got ordered. This is our first order that's in. These tests are in short supply. Every state is trying to get as many tests as they possibly can. And hopefully this order will be followed up with subsequent orders. Right before this conference, I was on the phone with a supplier, and hopefully we'll be able to get a couple 100,000 out of that supplier. So we're going to every resource we possibly can to buy these tests. And I've encouraged my team to to make this a #1 priority. And I'm thankful that they've done that. And we're going to start getting delivery as quick as we can and follow it up with subsequent orders, Ken.
Thank you, Ken. Thank you, Governor. We'll go to Jonah from the RJ and then Jasmine from the Nevada Independent.
Thanks, Megan. This is for the governor. We see from the CDC metrics, most of the state is in the high transmission tier, and obviously that's what the mask mandate is tied to. Has there been any discussion about changing the criteria for the mask mandate, or can we expect that that will be the sort of what we're doing moving forward with that?
Well, Jonah, I'm in the middle of a surge, with cases. It's certainly not a time that we're going to reduce any of the protocols that we have in place. I am hopeful that as we move along here in the next few weeks into February, this will peak and then plateau and start on its way back down. But I do not want our economy to take any steps backwards. I want our kids back in school, getting educated. The 5-day pause, I think, is going to help us in Clark County. And I know they're doing some things in both in Washoe and in Carson, which should hopefully help. But, we don't want to take steps backwards. And right now, we're going to stick with the protocols that we have in place and get these test kits in people's hands and hopefully get people back to work.
Thank you, Jonah. Thank you, Governor. We'll go Jasmine from the Indy, and then we'll go to Paul Nelson.
Hi, thank you. With the crunch that the hospitals are seeing and in the healthcare community, is the state receiving urges from the healthcare community and others to enact additional mitigation measures? Is that something the state is considering right now, like a statewide pause or anything along those lines?
Okay, and it's important that, I don't want false rumors being spread. I'll reiterate what I said one more time. We have no intention of any more additional mitigation measures moving forward. We encourage people to wear their masks when they're in indoor settings. We encourage people to get vaccinations and to get booster shots. Individual businesses are taking different steps, and it's their right to do that. And I encourage them to do that. But we work hand in hand with the health districts and all of our partners, and we'll continue to do so, but we don't want to take steps backwards.
Thanks, Jasmine. Thanks, Governor. We'll go to Paul, Emmanuel, and then Vanessa. And if you have a question, please raise your hand and get in the queue. And we'll take as many questions as we can. We have 3 more right now. We'll start with Paul.
Yeah, Governor, just how critical are these tests to getting on top of this and prevent, I guess the assumption is that this would prevent more cases from happening, which would then prevent more illnesses and deaths. Is that really why these tests are so critical?
That's exactly why they're so critical, Paul. What this will do right now, the waiting lines at some of these test sites, go into the hours that people are waiting in their car to get to the front of the line and get a test. And I encourage someone, if you're feeling sick, if you think you've got symptoms, go get a test, get in the line and wait. But once we have these tests in hand, once we have them, and you can go in the comfort of your home and take the test, and it'll relieve the lines at some of the testing sites and, give some folks peace of mind knowing that they don't have it. We're in a difficult time frame talking with my medical team. We've got people that are experiencing COVID symptoms, flu symptoms, allergy symptoms, cold symptoms, all at one time. And, it's difficult to determine exactly what they are. And this test will help alleviate or eliminate some of the options, I think, of what it could possibly be. So it's important we get these in people's hands. And if they test positive and you're not having any symptoms, stay home. Stay home the good old fashioned way, have some chicken soup and some orange juice and stay in bed as much as you possibly can for a couple of days, get through this and don't spread it to anybody else.
Thank you, Paul. Thank you, Governor. We will go to Emmanuel from Telemundo, I think, for the next question. And then Vanessa, you're on deck.
Well, thank you very much. My question is more about this test distribution of tests will help the people to know if they have COVID, but how we can manage the results in the way that, this test will elevate the numbers of COVID positive cases in the state. The people can report the results, so the state will have, the statistics about how many cases are increasing every day.
No, they're going to be self-reporting these tests. You're going to know your results, and it will increase the number of positive cases because we're going to do more testing, but it's going to greatly reduce the spread of the cases because once you get it, if you do test positive, we're encouraging everybody, stay home, stay in bed. Like I say, drink some juice and eat some soup and, get as much rest as you possibly can. And you can fight this off like you fight off the flu. So while there'll be a short-term increase in number of cases, there'll be a long-term reduction in the transmissibility of the virus.
Okay, my other question is about the Supreme Court just decided to block the vaccine mandates on the, in some United States business. This decision may, enforce in the people that are complaining about get the vaccine, how the state will manage to continue promoting that the people go and get the vaccine if they didn't.
Well, we're doing everything we possibly can. Every time I'm in front of a camera or in front of a reporter, I encourage people to get a vaccination or get their booster. Some people have questions, and I understand people might have questions. I totally understand you might have a question. If you do, talk to your healthcare provider. Call the health district. Call, our folks and ask your questions so that you'll be able to get them answered and you can have as much information possible. Don't go on the internet listening to all the, stuff and the rumors and, the theories and conspiracies that are out there. Get accurate information and then make an informed, intelligent decision.
Thank you, Governor. Thank you, Emmanuel. Governor, would you mind if I just ask Julia to talk a little bit more about if folks are using an at-home test, when they should go seek a PCR, which is the test that is reported to the state? Julia, I think you mentioned a little bit of that, but would you mind going over that briefly?
Yeah, absolutely. As I mentioned, this is really designed if you are symptomatic. If you do think that you are a close contact and you are not symptomatic, it's really important that you seek additional testing like a PCR test. I think it's really important to note that the at-home test kits are really empowering the individual and their family based on those results to take action, as the governor said. So if you test positive, you isolate your family members, need to really quarantine so that we're not spreading infection. Some of this information doesn't flow up to public health, but you can certainly reach out to public health and we can guide you in the next steps. I do just want to encourage you to look at therapeutics as well. I mentioned it a little in my talking points, but Nevada is doing a lot in that area. We just developed a new therapeutics page on our website. We're going to be standing up those freestanding clinics and opportunities for home health in that regard. And so it's really important, again, if you test positive, to follow up with PCR testing, and then we can help navigate therapeutics for you. The intention of all of this is to stop spread, but also to identify those people who may have severity in their disease and to keep them out of a hospital. And that's what we're doing with this whole spectrum of services that we've highlighted in this call. Melissa, I don't know if you had anything else to add.
No, nothing further. Thank you, Julia.
Thanks, Julia. Governor, we have 3 more questions, so we'll work through those. And then if there aren't any more after those 3, we will pull it to a close. We'll go to Vanessa, and then we'll take additional questions from Jasmine and Ken.
Governor, thanks for taking my questions. I have 2. The first one is, how concerned are you that our positivity rate is much higher than it appears to be, because perhaps people are not self-reporting the at-home tests? That's my first question. My second question is, unless I'm missing something, it appears contact tracing is not happening. Does that need to change, especially considering we're a major tourist destination?
Those are great questions. And contact tracing is extremely important, but a lot of it is we're relying upon the individual notifying people that they've been in close contact with. We've moved our resources and our team into both the at-home testing and the PCR testing, and to treat individuals that do have test positive. Our positivity rates are going to go up. There's no doubt. As you test more people and you find more positives, and as transmissible as Omicron is, we're running into more positive cases. But the upside of that is if we run into the positive cases, identify them, and then, as Julie said, isolate those individuals, it's going to stop them from going into work or going into the community and spreading it to other people. That's the goal that we're facing here. That's what we're up against, Vanessa. So hopefully this will work.
Yeah, Vanessa, the other thing I would just add is, as you know, the positivity rate is the numerator, number of positive cases. Denominator is going to be the total kits. And so we would be impacting if we had those at-home test kits both. So I think this is a really good proxy, our current positivity rate, because it is truly just the PCR test. And in some cases, we report out the antigen test as well. So it's really hard to say that the positivity rate would necessarily change because you're increasing both the numerator and the denominator quite a bit when we get those at-home test kits out.
Thanks, Julia. Thanks, Gov. Thank you, Vanessa. And we'll go to Jasmine from the Indy for another question, and then Ken from the AP for the last question. I don't see any other hands besides those two.
Thank you. Does the state know the percentage of cases that are caused by Omicron at the moment? And is there a place where reporters can find up-to-date information on that, on cases broken down by variant?
Thank you, Jasmine. I'll start. The Nevada State Public Health Lab, which Dr. Pandori runs, they have a really great website that breaks down what they're sequencing by variant. So we'll make sure we provide you a link to that. Julia, I don't think you would have that figure or percentage handy right now, do you?
I do not. Melissa would potentially, so I'll defer to her if she does happen to have it. The other thing I would say, Jasmine, is the wastewater surveillance is also a really good proxy, and we have a number of entities that collect that. We're looking to present that much more centralized and publicly because that is a really good surveillance tool as well. Melissa, I don't know if you had that information on hand.
Yeah, I would encourage you to look at the Nevada State Public Health Laboratory website. That is updated at this point in real time, and I know Megan will be sharing shortly.
Thank you, Melissa and Julia. Jasmine, we'll make sure we get you that. Ken, do you want to take it home today with the last question?
Sure. Thank you. And it's kind of a nuts and bolts question. Amid the governor saying positivity rates are going to go up, Ms. Peak says some of the information these home tests doesn't flow to public health. And Emmanuel's first question, just help me focus. Are the numbers, are the positive tests from at-home tests going to be factored into our coronavirus metrics that the DHHS is compiling? Thank you.
I'll go with that one first, then go to Julia. Those results are not going to be reported to us directly. Just like the people that are right now going to your local Walgreens or CVS and buying at-home test kits and taking them, those results are not coming to us. So what this will be is it's another tool, and we're using every tool possible to protect our communities and to protect our economy. This will give people the knowledge that they will know on this antigen test, whether they're positive or they're not. If they're positive, as Julia and Melissa and I have all said, we encourage them to isolate their families until they get through this. A lot of people are testing positive and have very few, if any, symptoms, and they don't need to go to an emergency room. We don't want them to go to an emergency room because that's what's clogging up the emergency rooms, and we can't take care of the people that desperately need it. So those numbers will not be directly reported.
Yeah, I would just add, Ken, that at-home test kits, as I mentioned, is just one of the options for testing in the state. If you test at one of our large community-based testing sites, which tends to do a PCR that's sent out, if they test at a school, if you use a point of care test at schools or other settings where they use that type of tool, that's all reported up to the state. So you'll see that testing increase substantially over the coming weeks as well. So both the numerator and the denominator will change in what you see on the dashboard. And then we're going to be actively tracking at-home test kits, both distributed by us. And then also there's going to be at-home test kits, as we mentioned, through our federal partners. We're also going to try to get a really good idea of purchases or pickup of those. And then we're working with pharmacies to track purchases of at-home test kits through another project that we have. So we're going to try to use all of those different tools to get a pulse on what's happening in the community.
And understand, Ken, the at-home test kits, you're going to get your results in 15 minutes. It's not 2, 3, 4 days later. It's 15 minutes later. You're going to see what your test results are. So the expeditious nature of that should help us.
Thank you, Julia. Thank you, Governor. And John has his hand raised. So as long as you're good, Governor, we'll take that question as well. So go ahead, John.
Yeah, sorry to sneak one in at the end here. We're just 3 weeks out of a really big weekend with the NHL All-Star Game, the NFL Pro Bowl, a lot of visitors coming to town. Are we still on track for that? What are the projections from the state, and how cautious are we to have 2 really large events happening on the Strip amid a real spike in COVID?
I'll reiterate it one more time, John. I don't want to take any steps backwards. You're right. We've got some big events coming forward between the All-Star game and, different things that are coming up, but we also just came through some. We came through Christmas, we came through New Year's, we came through the Raiders playoff game, we came through making the playoffs, we came through several Golden Knights games. We've got a lot of events that are occurring regularly. Those events translate into jobs. I want to do everything I can to keep our folks working as much as possible. So we're not anticipating any changes. I was very pleased that while CES was reduced capacity this year, reduced attendance, they continued on with their show. So CES did occur, and I encourage other places to come. And these purveyors need to know that we're doing everything we can in this state and in this community to make it a safe place to come.
Thank you, John. Thank you, Governor. I don't have any more questions in the feed. Governor, if you want to make some closing remarks, we can do so, and then we'll pull it to an end.
Thank you. I appreciate it, Megan. And thank you, Chief and Julia, for joining and for participating. Melissa, I wanted you to follow our website so you know when these tests arrive. We'll be providing more information as to when they arrive, what the availability is going to be, the number, the places where they're going to be, the hours of the various places and whatnot. I'm thankful to our community partners that are participating in distributing these. And as I say, this is not the end all, be all end all. This is just another tool that we're using to help spread to help stop the spread of this virus. But the biggest one we can do is, again, I'm going to reiterate, if you haven't been vaccinated, please consider doing so. If you haven't gotten boosted, please consider doing so. That's going to help us get through this pandemic. So I thank you for that.
Thank you, everyone. Have a great afternoon. Thank you, Governor.
Thank you.